of this play, this story, are still things that are happening today. And so, as much as it's great to spend time together and share space and community, it's also a difficult thing that we're talking about today. So I'm gonna give us some prompts once we get a chance to introduce everybody. But again, my name's Alan Ryloff. I'm really glad to be here with you all and share space with you all to talk about this serious topic.
Thank you. My name's Yvette Cantu-Schneider. I met Stacey when I was volunteering at our center. And I'm here, I guess, as the woman's voice of, I grew up in LA and I came out in 1986. And that was around the time when a lot of my friends were testing positive and dying. And yes, myself and some other lesbians were the only people really available to take care of them, because most of them were not from Southern California, didn't have family, and there was no one else to do it. Enough for now.
Hi, my name is Richard Kleinberger, actually Dr. Richard Kleinberger, and also met Stacey through participating in our center, and she asked me, what perspective do you have, if any, based off that period of time. I also grew up in Southern California, and I went into healthcare, and I used to work for what's the AIDS Healthcare Foundation back in the late 80s and through the 90s, and we were dealing directly with obviously a lot of our community that was dying from AIDS, and at that point we didn't really have the medication, obviously that we have today. The ACT didn't come out till much towards the 90s, so a lot of that was patients were dying of cancers, infections, and so I was on the forefront of treating those patients, both as a healthcare professional, but also something that was very personal, because myself, being at that age would have put me heavily at risk, but luckily, as was mentioned in the play, I was in a very long-term relationship, and I do credit that for pretty much saving me as well. So, and I dealt a lot with, obviously, in the LA area community at that time.
I'm Jim Stowers. I also, I'm a volunteer at our center where I met Stacey, Alan, Richard. And I came of age as a gay man in the late 80s, and have lived in many different places, starting in the South in Arkansas, which was its own experience in terms of being gay in a rural southern state, but then went to college in Chicago, went to law school in St. Louis, have spent most of my professional life in Washington, D.C., and now, since a few months ago, I now reside in Reno. So have congratulations, first of all, on a wonderful production,
Yes.
wonderful play. Also, the music was a nice touch as well, kind of took me back to those times as well. But I, have experience in government primarily as my career, and certainly have some thoughts around kind of some of those issues that we dealt with in the 80s. But I'll stop there and look forward to our discussion in that panel.
Yeah, Stacey Spain directed the show, have worked with Bruka a lot. I'm the executive director at our center, which is the LGBTQ Center for Northern Nevada. And it's my joy and pleasure to get to serve my community in ways that both provide programming, support, and shared community across all ages. We say cradle to grave. We're queer when we get here. And so when I think about growing up in rural Idaho, there was no place like our center when I was coming up, right? And so We have teenagers that come to our center, and I think, you know, as sometimes difficult as teenagers could be, sometimes a little smelly, whatever. They're teenagers. You know, they're teenagers, and they get to come to our center, and they get to have a home and have a place where their elders can impart community culture with them and share our history. And so the idea for this panel and the idea for some of the audience stuff that we're doing with this show actually happened because a friend of ours and a friend of this theater, Kel Cattell, was in our center and happened to start talking to some teenagers, and the teenagers were enthralled and didn't know what they didn't know about this time. And so that's when we started talking about how we can share this history.
Thank you.
Yeah.
That was one of the things that I'd say is, since we're all talking about how we know Stacey, I'm on the board of our center, so I'm on the board of directors of our center. I also supervise the social work interns at our center, so a lot of the programs and services that our center provides, the interns are connected with that, so I supervise them, so we're all a big happy family here. So, a couple of things that I wanted to make sure that we just like had in context, and that is that the year that this play was set, in 1988, about 18,000 people, just under 18,000 people died that year alone from HIV. That was predominantly queer men who had sex with men, so we did see at those times the sort of enclaves of queer neighborhoods being virtually wiped out by this disease. The year that the play came out, which was about 5 years later, there were twice as many people dying per year, and that was just before the antiretroviral drugs that really sort of stopped a lot of the spread or slowed the spread came out. So around 50,000 people dying a year. That the year that this play came out was one of those years with the highest number of people who died in the United States alone. That's just the United States. As of 2023. More than 40 million people in the world have died from AIDS and AIDS-related causes, and about 40 million people currently today are HIV positive in the world as well. So this is not a disease that has gone away. It's not a disease that is somehow safe or no longer killing people. We have done a lot of work to slow down the spread and to figure out ways to treat HIV, to ensure that people who are HIV positive can live full, healthy lives. We even know now that if people are on treatment and that treatment is effective enough to get their viral load down to what we call undetectable, that means that they can't even actually transmit HIV anymore. Yeah. And that can extend their lives, so their lives really can live as long as they would be as if they were not positive. But it is still a deadly disease that still does kill about 1 million people a year annually in the world at this point. And so some of these things are things that I think about a lot as a professor when I teach my students. Social work, we think a lot about evidence and data, and also think about the environments that impact people's lives. One of those sort of things I talk to my students about when we talk about HIV is actually a point that Yvette brought up, and it's the idea that at the time there was no one who was really taking care of gay men. Because a lot of gay men were dying, and at the time the stigma around homosexuality was much higher even than it is now. And so people's families were not coming to take care of them. At the time it was legal for doctors and nurses to refuse to treat HIV positive people. And so what we saw is we actually saw this really beautiful movement of lesbians taking care of gay men. And that's actually why the L is the first letter in LGBT, that one always gets me. The reason why it's LGBTQ, the reason why the L is first, is to honor the lesbians who took care of the gay men who were dying during these pandemic. Right?
Yeah.
So when we think about this play, this play is about, it's all set in a map store. It's all set in a place about places. it's an environment where we think about where things are happening by its very nature. And the first time this play was produced, it was produced in Evanston, Illinois, a suburb of Chicago. And it's not explicit in the play where the play is set, but I know Stacey and I were sort of imagining it in Chicago, just like in our heads. And that comes up a lot that really brings up things for me, because my first job out of high school was in Chicago doing HIV counseling and testing. So I would do testing, HIV testing with people, do counseling, help them think about how they reduce their risks. And then often, I would be the one that would tell somebody if they were HIV positive. Oh. And this was a really impactful thing for me, because I wasn't really like a coherent adult human in the 80s. I was born in 1984. And so by the time I became a high school student, by the time I sort of became an aware queer person, by the time I became sexually active as a queer masculine person, much of what we would understand as the crisis of the AIDS crisis has passed. But I noticed very distinctly in my time that I didn't have mentors, I didn't have role models, there weren't people in the community that should have been there, because the crisis took away so many people from our community. And I realized that so much of my work in sexual health and sexual health education was the sort of next generation of trying to figure out, how do we save people from this disease? And how do we also help people live lives that have quality, and that they can leave the house or the store, that they can go spend time with their friends? How do we do that balance of keeping people safe from a disease and keeping people safe in their mental health at the same time? And to sort of have inherited that has been something that, frankly, has like weighed on me for many years. I still teach about HIV extensively in my courses. And so when I was sort of thinking about this play, when I was reading the script for the play, when I watched it, a lot of that was what was coming up for me, is this sort of memory of how HIV affected me as a young person in this sort of next generation of people post-crisis, and how the world could have been different if I had more of those role models, if we had the artists and thinkers and wonderful people and just day-to-day people that we didn't have because of the crisis. So what I wanted to bring to this is the question to offer to the panel, and then after we go through this question, we can open up to your questions. But what I really wanted to bring to the panel today is to ask, what came up for you in your memories? When we're thinking about memory of that time, memory of your friends, your experiences, and memory of loss, what was coming up for you when you were watching the play, when you were sort of thinking about this talk and this experience?
I'll go. For me, it was the especially with Jody, and the fear, that just this deep internalized fear that he had of fear of the virus, fear of he was like sheltering in this map store to presumably self-preservation is what he was ultimately trying to accomplish. But it was interesting in the second act when they went through the HIV test, and that was such a gauntlet in the early days. It was full blood draw, nothing instant, no oral swabs, no pinprick on the finger. It was full blood draw. And then I recall, this was maybe mid-80s, the wait was like 2 weeks. 1 week was pretty quick, and maybe I thought this map store was set in New York, and maybe they had the most advanced or something, but and you had to go in person to get your result in the early days, because if you had a positive result, you were required to get some sort of, you needed that counseling. And I think men, because this primarily, at least my experience with being gay man myself, and having gay circle of community of gay men around me, that men are not generally the best about medical care, and we didn't talk to you wouldn't talk to your mother about that. You wouldn't likely have a spouse, a a female spouse that would support you in medical care. And so just the idea of getting that test was really, you know, it was like if you got a positive result, it was the equivalent of a death sentence at that time, because there was no light at the end of the tunnel or on the horizon with respect to, you know, a drug that would save your life. It was, you were basically gonna die in all likelihood. I'll just give one other comment and I'll let the other panelists share their thoughts as well. The other thing that struck me was Carl and how he was rallying to support his community and how he was rallying to do the work that had to be done because nobody else was there to do it. I'm incredibly grateful. I know the lesbian community stepped up in a big way, and I didn't actually know that about the L being first in the acronym, and that's a great honor and a great thing that's the way that it is. But the idea that in those first years, from the first time that this disease was reported publicly in 1981, in the summer of 1981, until, you know, Ronald Reagan was the president at the time, said the word AIDS publicly, I think in 1987. But somebody, I mentioned working in government, so I work professionally on the Democratic side in my own profession. But I would even call out my party as well. We didn't talk, the Democratic Party wouldn't talk about it either. I think Nancy Pelosi was the first person to talk about AIDS on the House floor in 1986. And so so that gives you a sense of the stigma that we faced, that gay men in particular, but the stigma that existed at that time, that neither political party would talk about this, was rallying to come to our aid. We were on our own. We had to figure this out. We had to organize. We had to, you know, create groups like ACT UP and other Gay Men's Health Crisis and other organizations to try to get some kind of help, try to get some kind of medication that would help us. Ultimately, we were successful. It was a long march, but ultimately we did it. But I'll stop there and let others.
For me, I think was sort of like two-sided. One, being a gay man, a gay person in a community and in a place like Los Angeles, where you sort of felt like, you know, you were pretty progressive. You know, people kind of knew you, and it was okay. At the same time, there was this really concept of loss, a lot of loss, because there was a lot of stigma, even in a place like that. People were very afraid, and I think it was both outside of our community, even inside of our community as well. And I would say I had the fortunate experience to be able to work with patients that were at the end of the course of their disease. So that gave me the ability to sort of see everything through their eyes and what they were going through. And I think there was like you mentioned, there was a very strong, we're all on our own in a way. A lot of these patients, their families didn't exist. There was nobody there. Hospitals didn't want to necessarily take them. So obviously we organized very heavily. In the 80s, we started the AIDS Healthcare Foundation, for example, in Los Angeles, that at that time did a tremendous amount of work in resources. So I had a lot of great pleasure to work with them at that point to sort of give back to the community. Sometimes I felt, you know, and I was fortunate, I guess, in a way that I didn't lose that many people in my life. I don't know why. I can't say exactly why. Maybe just everybody was kind of more aware at that point. But just a sense of loss was probably very big for me, because even I got to know some of these people by dealing with them as what they were going through their disease and how they were unfortunately dying, and that had a very profound effect, even though you're supposed to be used to it in our profession, but you don't. And I also got angry because I could see like at that point, the government was delaying any kind of research or and just acknowledging the existence of that condition. And I almost felt in many ways that it was kind of a metaphor, like a bus. It opens up the door, all these patients are going in that just got diagnosed, and all these patients were going out that were dying. So that to me was very profound for me. At the end, and then eventually when the drugs started to come, we obviously saw that start coming back down. But like you said, we lost the whole generation. I saw the generation disappear. I saw my own peers in a way, people, doctors and artists and just you know, going away, and that generation is gone. And sometimes I say, so wow, I'm here from that generation. I don't know why I'm here. I guess I'm lucky in that way. It's something, you know, it was good. But for me, it was an overall profound sense of loss. I think loss for the community, loss all those great artists and people who have contributed so much, if they were still here, and that next generation never got to see that, you know, never got to experience that part. And I still feel that people outside of the community, especially in places that aren't like, let's say, West Hollywood or other places, they don't really understand. You know, the younger generation, they don't necessarily see it, but even most people seem to have somewhat forgotten how many people and how they suffered through that. So for me, that will always be something that, you know, is that loss that I take away.
I think for me, as they start pulling out the chairs, I started naming my friends, and then bringing out more chairs, and I'm naming my other friends, because when I came out, my friends celebrated me. I had gone to college at UC Irvine, and I worked at a hotel in Laguna Beach, and that's where I met my first gay friend, Ed. And then it was right across the street from the Boom Boom Room, the gay club there. And so it wasn't so much that so many lesbians had gay male friends back then, they didn't, but I did, because when I came out, they celebrated me. And then they were so afraid when they were HIV positive and had AIDS that they were somehow gonna give it to me, that they didn't, you know, they kind of fought against and pushed back against me helping. I had a girlfriend at the time, and her brother was the first one that we knew who had AIDS, and he got it, everything advanced so quickly that we were the only ones there to take care of him. And so we set up a schedule to go and do laundry and cook food and go grocery shopping. And as he was, you know, wasting away to blindness, which many of them did. And it was really hard going through that. And she and I ended up breaking up, but then I lived with my friend Ed, so my first friend, and he was from Argentina. And Mario and Daniel are also from Argentina. They had no family here. And then Ed's partner, Mike, so I moved in with both of them. And they were so afraid that they were somehow gonna infect me, even though we knew that was not how it was transmitted. They'd say, okay, these are your dishes and plates. And then nothing could be washed by hand. Everything had to be washed in the dishwasher, because they were just like, don't do any of your laundry with our laundry. They were just so careful and so afraid. And then I saw virtually all of my friends. So I ended up having to set up a time schedule. Like, I worked, by this time I graduated from college, I was working in downtown LA, and I had to set up a schedule of, okay, Mondays and Thursdays, whatever it was, that's what I'm doing at LA, my LA friends, and then Tuesdays and Saturdays, because that's when the traffic was the best, is when I'd go to Orange County and help the guys in Orange County, and it would be all of that, like mostly laundry, food, and then it would get to the point of someone had come back from the hospital, and they still had, you know, IVs that needed help changing, and, you know, I'm not even gonna get into the ugly details of it, because it's not a great disease, and there are a lot of GI problems, and Kaposi sarcoma, and then the blindness. And it was, my daughter was here from San Francisco visiting this weekend. My other daughter was here today. She's 22 and 24, and I'm thinking, I can't imagine them doing this today, but this is what I was doing when I was their age. And there wasn't any kind of, well, I'm wasting my youth on this, or resentment or anything. It was just like, these are my friends, and they're already suffering. They don't need to suffer more. Like, all I can do is what I can do to help them get through this. And then, like in this, I just look at that as a completely different past, separate life, because those people have been gone now for so long. It seems like that was just a different lifetime. And I didn't know during that the lesbians were the ones helping, because I was just helping my friends. I wasn't looking at any kind of bigger pictures, or didn't know much about what was going on, just that there was nothing that was gonna save them. So it was to give them as much care and dignity as I possibly could the time that they had left. And I guess that's it. I just have one other thing to say, only because it popped into my head, and that was like these chairs and how crowded it was getting. So one of the couples that I was helping, and this was the problem, was like even the ones with partners who both ended up getting sick and really sick around the same time, so they couldn't help each other. So in Eagle Rock, I had friends that had owned an antique shop, and instead of getting rid of the antiques, they brought them all into their house. So it was like them trying to move around on the stage was reminding me of that, because you go in their house, and it was like trying to get through all of this clutter, and can't you get rid of this? Can't you have someone like sell it, someone take it? And they would not, because I think that was they were holding on to that, like this is all we have, and if we get rid of that, it means that we're gone. So,
Thank you. You know, I came up in theater, and my son Matt was born in 1986, and I was working at Idaho Shakes at that time, Idaho Shakespeare. And I had two mentors, Ted and Guy, and their names are here on stage with us. And Matt was, you know, raised in the costume shop. He took naps in the bins of, you know, all the fabric, and that's where he was. And Ted and Guy absolutely loved him. And my husband at the time came to me and said, Matt can't go to the costume shop anymore.
Oh God.
And I got so angry, because I thought what he was saying was that they would get Matt sick. But no, what he said was, Matt's gonna get them sick. And so, yeah, he was a good guy, that first husband of mine. And then I just wanna like close that by saying, you know, that Ted and Guy are missing from my constellation of people who could have helped me in theater, right? They were my mentors that were not there. And that at Idaho Shakes, we lost 7 people in 6 months. And then I want to close the circle again by saying my son's a nurse.
Yeah.
And his first job in New York City when he moved to New York City was working at an AIDS hospice.
Yeah.
And he loved the work. And it's completely different now because the dudes are just old.
Yeah.
They're not dying of AIDS, they're dying of old age, right? So I kind of love that for him, that he got both of those things, and yeah. We don't often get to have a piece of theater that so clearly helps us draw experience from our lives, and that's why I think this play was so important. And I want to mention, I mentioned it at the beginning, and I want to mention it again. This play was brought to us by Brian Jensen and Kel Cattell, who are both wonderful volunteers here at Sub-Bruka. And they have their chairs here on stage from their friends. And they just simply couldn't come today. They wanted to be here, but it was too much for them, and I'm hoping that we'll have seats for them whenever they can be here. And I think that the definition of magic is bending, to bend wood, wicca, to bend. And I think that theater creates space where we can create magic together, where we can heal our communities, where we can ask for action. So.
I know I said I'd open it up for questions, but I do have one more thing I wanted to say, or really ask the panel, because something that I think has come up in a lot of things we've heard, and I think came up in the play almost a little bit. I don't know, I think Jody's struggle, a lot of what I saw in Jody's struggle was this idea of what does it mean to survive, and this idea of being the survivor of something. And now when we're thinking about the generation of queer people that we've lost, a lot of the things that are coming up is thinking about what does it mean to have survived, and what does it mean to experience all of that loss, and then, you know, now maybe be sitting here in this room 40 years later, and how does that come up? So I think that's a question I wanted to offer, is how do we deal with, confront, grapple, face survivors of something? I don't know if it's guilt. That's often the language you use.
I think there's part relief, let's be honest. The other part I think is a little bit of guilt in a way that I didn't suffer that situation. So almost I would say it's kind of a little bit like PTSD in a way, right? Because you have memories of that, and then you kind of tuck them away, and especially when you look at all the achievements that have occurred since then, whether it's medications, now everyone can live a long life, you know, they have to worry about their cholesterol, that's pretty much it, right? For the most part. So I think I take away from that is always trying to give back somehow. You know, if you can, back to the community, action, donation, I know whatever works for you. I think that's important, so you can feel that at least you're kind of trying to make good for surviving, and now trying to give back to the next generation that's coming through. I think it's important to keep like you said, you were talking, the history has to be there. It can't disappear. And I think that's something that we have to still work now. Those that survive and the younger generation, for me, is keep alive. And we shouldn't diminish, you know, we shouldn't whitewash it. This is what it looked like, and it was pretty bad. Yeah, you know, if you knew some of the patients, you know, that were going through their last periods of their life. So, but also we should kind of we shouldn't rest on our laurels. There's still a lot of things we still have to do as a community in today's environment. So I think it's about action. I think that for me is what I take away from that, giving back.
Yeah, I've given a lot of thought, I've given a lot of thought to this question, Ellen, and it is, I became sexually active in the mid-'80s, I think, for the first time. So I kind of feel like the meteor hit around 1979, 1980, when people didn't even know this disease existed, even though it did exist and it was spreading, we just didn't know it yet. And people didn't know what was happening to them. We would find out very shortly after that what was happening. So here I am about 5 years out of that window, and I feel like I felt the impact. I could see the impact. I wasn't struck myself, thank God, but there is some sense of that there's just a lot of internalized fear, a lot of internalized shame, a lot of things to grapple with personally and on an emotional level with that, you know, that survivor thing. I think, you know, I guess for me as well, I think recognizing how resilient our community was, though, at the same time, and picking up a little bit on what Richard was saying, and how, you know, from 1980 until the late 80s, we were so politically powerless as a community. We were utterly powerless. Nobody wanted to talk to us. Nobody cared that what was happening to us. But we were able to organize as a community and make an impact and make a difference in terms of pushing the FDA on drugs, you know, pushing the powers that be, the drug companies on the pricing and all of it to fight. And we were successful in some of those battles. But it also, you know, laid a foundation that once we realized that we had to organize to survive, we had to come together as a community to survive. It also laid a foundation for future victories that we all experience today as well. And so I also look back and just think how resilient, you know, I'm proud how resilient the gay and lesbian, the larger LGBTQ community has been in terms of being able to fight. You know, we're tenacious. We have to be, and that's something I'm very, very, very proud of.
I think it well affected me in a couple different ways. And the first was, one of my daughters when she was 5 was diagnosed with leukemia, and I think that I ended up seeing a therapist who said, you know, I think this is PTSD, like what you're describing. And I had never ever thought about PTSD or thought it would pertain to me, because then it was just people who had gone to war, right? So how could this be me? And then saying, oh, yeah, because of all that I had witnessed. But I looked at the lives of my friends. I thought about this for a long. I've thought about this for the rest of my life. Like, their lives were so short, they didn't get to accomplish all the things that they wanted to or were on their way to accomplishing. So is that the meaning? Is that what brings value to someone's life? Was their value just nothing then? But these were people who, they helped me, they helped each other, and that was the meaning of their life. Like, what the light they brought to the world that was the meaning of their life. And I've thought about that ever since. Like, what's gonna define me? What do I tell my children is gonna define them? It's like just that light that you bring, the respect that you bring to other people, the way that you care for other people. I think those are really the two things that I've taken away. So I, not having been a gay man and not being one of the ones that was at risk, I didn't have that sort of survivor's guilt in that way. But then it was, well, okay, so why didn't it happen? Why did it happen to this community and not that community? So I think that's it, to say that, these lives are meaningful and ours are less now.
Yeah, like I said, definitely that's a very important point, that we have to honor their lives.
Yeah.
So I think what's important for me is never to apologize for who you are, and always, from our generation, always make sure that we are seen, reflected, and heard, and we just don't apologize, no BS, so to speak, right? And we have to be seen as equal as everybody else, and I take away from that, because of all that stigma that was there during that period, and it was also within the community to a certain degree, but a lot from the external community, like police, everybody, in the community was almost as bad as the actual disease itself, and that left a lot of scars for us. So I think the resiliency, and never to say, never to apologize, never to compromises, I guess, was really important for our community at this point.
I just keep thinking about never forget, and on this, and this is just one of the chairs. I just want to read these names. Tony Archangel, Larry Atkins, Bobby Baca, Jeff Barker, Kevin Barnes, Ken Burns, Larry Burton, Robert Baruso, and Dr. Lisa Bechtel. There are 388 names on stage with us, and each of them is a full, complete life with people who love them, and who didn't get to finish their contributions. And so now it's up to us to remember, put back together our culture so that it means something. And the first thing is to not forget all of their names.
So I did want to open it up to you all. If there's any questions for the panel that you wanted to offer today.
Thank you all for sharing your experiences with us.
I don't have a question. I just do thank you for sharing that, and it makes space for me to experience again this time. So I began medical school here in Reno in 1981. I was a nurse before that. And I remember the first, I don't even remember what we called it then, the first patient who was dying in the ICU, who was a prostitute from Mustang. And, you know, terrible stigma amongst the professionals. But I also remember the fear among the providers, because we didn't know. You know, nobody knew. Look at the pandemic, the COVID, thank you. You know, when we didn't know if it was airborne, if it was particles, all that stuff. Well, this was that and more. So thank you. I'm mortified that I cannot remember the name of the first patient I had. He came into my service my first day of medicine as an intern, and he died on my last night. And, you know, so that was 30 days. And now I can't think of his name. And he taught me a lot. And, you know, the only other thing I want to say is I spent a year in Kenya recently, and you'll be able to correct me, Alan, but something like 3.5% of the United States population is HIV positive. In the area I was in Kenya, it's 25% of the population is positive and living with this disease. And at that time, 5 years ago, we had lots of drugs supplied by USAID that kept people safe. And anyway, it's a profound contrast, that culture with what we all lived through.
you got to come see a funny show. And you did, thank goodness, right? Thank goodness that it has both light and darkness, which is what theater is so good at.
I think that some of the last points are brought up, I think are very important for us to consider is that, especially if we're thinking about things that happened a long time ago, like we're talking 30, 40 years ago at this point. It seems like those things are in the past, but it's not. And HIV, I think, is something that connects now to then very clearly. And given the political context of it, that political leaders made decisions about whether or not to even acknowledge that the disease was killing tens of thousands of people a year. Political leaders made decisions about what to fund and what to say about it and how to treat people about it and how do we care for people. And USAID does not exist anymore, and that provided millions of dollars of AIDS-related support across the world. And more funding has already been removed for other medication distribution, even in the last year. Research, I mean, the amount of money that's been deleted from research is going to set back not just HIV research, but cancer research and all sorts of other health research by decades, if not literally centuries. The longer that this is happening, where the same kind of things that were leading to so many people dying in the 80s are happening now. And more people are dying because of it. We just can't see it all and point it all to one thing like HIV. But those things are happening now. And there are ways for us to get involved now. And I think the thing that kept coming up in these conversations was community and how we need to care for each other. And that the way that we get through times like this is by showing up for each other, by being present for our friends and our family members and our colleagues and sometimes strangers, that we need to show up for those people. And this is the time to do that. We have not been, and the queer community has not been under political attack in the way that we are now, like we are now, since probably this time that we're talking about. We're losing healthcare across the country. Transgender kids especially are losing healthcare, and it is leading to their deaths. Like, we are seeing a pandemic of suicide in trans youth that can be directly attributed to their access to healthcare. And so these themes that we're thinking about in these moments of how we're losing people because of political inaction and because of stigma, that's all today. This is a play about today, unfortunately. And I want to invite all of you and all of us to engage in community, to find people and places that are doing work to help care for each other. And I know that a lot of us are connected to our center. Our center is a great opportunity for that. And also there are other organizations, and there are other things that we can do. And there are other mutual aid organizations, there are health organizations. But the way to get through these dark times is community. The way to fight fascism is community. The way to fight and bring light in the darkness is community. And if I take anything out of this play, that's what it is that this friendship between these two people is what gave it meaning. Like Yvette was saying, like, lots of people have passed with very short lives, but those lives aren't meaningless because of the relationships that they had and because of the ways that we connect to each other and care for each other.
Thank you, Alan, and thank all of you too. Yes, Barb.
So this is a bit of an odd observation, but our two actors,
They're right over there, by the way.
last time I saw them act in a small space was the Diary of Anne Frank years ago. And while the stories are very different, of course, but they are still stories of fear and hiding and oppression and stigma and
Well, thank you so much, everyone.